The next organism we're going to talk about is Helicobacter, and Helicobacter is the other microaerophilic organism that we kind of mentioned back in chapter 1. It's also kind of spiral or curved shaped rod bacteria. It does not grow at 42 degrees, but it's also oxidase positive, so those are some of the features. Helicobacter pylori is the species we're going to be talking about today. And as far as distinguishing features go, the one that you really need to remember is that Helicobacter pylori is urease positive, because that's one of the ways that we're going to be able to test to see if someone has Helicobacter. The reservoir for Helicobacter is humans. It has also been shown recently to be other animals, so it's possible to get this from a domestic animal. Transmission, as far as we know, is oral-oral or fecal-oral. It seems to spread within households. So those are some of the mechanisms. As far as pathogenesis goes, Helicobacter pylori, most of you already know. If you see duodenal ulcer anywhere in that case, you're going to automatically probably be thinking about Helicobacter pylori. So the pathogenesis, though, involves the urease that we talked about. If we are thinking about organisms that can actually grow and replicate in the stomach, this is really one of the only ones I can think about. Because of the acidity of the stomach, really prevents most organisms from growing and replicating inside the stomach. Now, organisms can get into the stomach, survive, and make their way down into the intestines. That's very common, but to actually grow and replicate in the stomach takes a little bit of work. Now, H. pylori can do that because it has the urease, and it also has a mucinase, and those two features alone help it grow and survive well in the stomach. There's a lot of inflammation, and the organism also possesses a cytotoxin. But when we're talking about ulcers, we're really talking about H. pylori. So chronic gastritis, duodenal ulcers, you want to be thinking about H. pylori. Now, some of the things that are associated with H. pylori can be gastric adenocarcinoma. And for the boards, any organism that is linked to causing cancer is something you really need to be familiar with. So go ahead and make yourself a list of all of the agents, and you'll see more of them when we get to the viruses. But all of the agents that are associated with the formation of cancer, you need to have that in the back of your head because the boards like to ask you about those associations. The other thing that you can see with H. pylori are called maltomas. And these form in the intestines as well, and they will actually go away after treatment with antibiotics for the duodenal ulcer. So this is one organism that's classified as a type 1 carcinogen from the World Health Organization. Now, diagnosis, there are several things you can do for diagnosis. We have rapid tests. Those rapid tests, you can really only detect right now, you can look for antibodies. So it doesn't tell you whether you have a current infection or an active infection, but it will tell you whether you've had an infection in the past. So still the gold standard really is the biopsy with culture for diagnosis of H. pylori. There is also a breath test that's available that actually detects the urease that the organism produces. Okay, so you want to be thinking about that for diagnosis. Now, as far as the treatment goes, again, this is one of those that's going to be like TB and like some of the other organisms, although you don't have to treat for as long, but it's a multi-drug regimen. Treatment is listed for 10 to 14 days, but it can also go as high as 21 days or 28 days for treatment, depending on if the organism is cleared or not. So it's a multi-drug regimen of omeprazole, amoxicillin, clarithromycin. That's just one example. There are several different combinations that you can use for treatment. So it's fairly difficult to treat Helicobacter pylori.